Hi, my name is Holly Vanderhyde. I'm an adult geriatric board certified primary care nurse practitioner and a certified hospice and palliative care nurse practitioner. And I'd like today to see if I can clear up some confusion about hospice patients going to the emergency room. These are the places I get my information. All three of these websites are very reliable. You can answer any questions you may have about hospice by looking at those websites. Since this is not an educational or technically professional presentation, I'm not going to do my citations at the end of my presentation. These are all the places you can go to get the information I'm talking about. So first things first, two of the ways you can be off of hospice once you sign up are revocation or discharge. So what's the difference between those two? Revocation is something the patient or the patient caregiver or power of attorney does, whereas discharge is something the hospice provider chooses to do. A revocation is something that the patient will sign if they decide to get treatment. If they decide they no longer want hospice, there's no real reason you need to have, just the fact that you no longer want hospice, and you can revoke your hospice benefit, go back to whatever medical coverage you had prior to your hospice sign-up. Discharge, when the hospice provider discharges a patient, it's either because they no longer meet criteria, they've gotten better, which is considered graduation from hospice, which is not necessarily a bad thing. The fact that maybe they're non-compliant, they refuse to do anything we ask them to do, so we're really not serving their needs, so there's no reason for them to stay on hospice, so we can discharge you. And if you move out of the area, those are just some of the reasons that a hospice company will discharge a patient. So the first thing you look at if you decide whether or not somebody has to come off of hospice when they go to the emergency room is, what is the primary hospice diagnosis? Is the reason you're going to the ER related to that hospice diagnosis, and how do you know whether it's related? Let's take a look at a couple of examples. So say you are on hospice for COPD. COPD can be emphysema or pulmonary, whatever pulmonary issue you may have that makes it difficult for you to breathe. It's an obstructive condition that's progressive and will eventually take your life. So say you go to the ER for trouble breathing. Well, that's pretty obvious. That's related to your COPD. So if you call up 911 and decide you want to go to the emergency room because you have trouble breathing, you will most likely be getting a bill because your insurance company is paying the hospice provider to take care of issues related to your hospice diagnosis. So if you decide not to call the hospice company but to call 911 instead, they transport you and treat you, you will most likely get a bill. Say you go for a broken bone. Broken bones are not a result of COPD, or not an expected result, and so you most likely will be covered by your insurance company for treatment of a broken bone. But before you go, you absolutely want to call your hospice provider and let them know, this is what happened, I'm calling 911. They in turn will call the hospital, stay in touch with them, make sure they're aware of whatever treatment you're getting, and also make sure the hospice or the hospital knows that you are on hospice for COPD. So I just had a little uncontrolled cough there, and that, if you are on hospice for COPD would not be a reason for you to go to the ER, because that is something that is expected with COPD. So you would call your hospice company. They would most likely send a nurse out or talk to you over the phone, give you a new prescription, do whatever they need to do to help you with that uncontrolled coughing. Say, for example, you are on hospice for COPD and you have a bout of diarrhea and vomiting. That is not an expected result of COPD. However, it still is something that does not require, normally, emergency treatment. It's something you want to call your hospice provider, have a nurse come out, do a little evaluation, and if you need a medication, that nurse will call the medical director and get a prescription give the doctor the information they need to prescribe something for you to take care of that diarrhea and vomiting. Let's say you're on hospice for colon cancer, and we know it's spread because if you have cancer that is in one place, you are not hospice appropriate. If you have cancer that has spread out from where it started, then you are hospice appropriate. Colon cancer often spreads to the liver. So say you go to the ER for constipation. Constipation is absolutely something that does not start in a second. It's something that starts gradually. That is something that should have been addressed by your hospice nurse. So you call your hospice provider and you get that taken care of, because there are many medications, many interventions we can do to get that constipation moving again. If you go to the ER for constipation, chances are, if you are on hospice, you may well get a bill, because that is an expected result of having colon cancer. If you do end up going because you think you have a blockage or some such thing, you will need to sign a revocation saying, I'm giving up my hospice care because I want to go get treatment for whatever. And then once you finish that treatment, if you're admitted, they say, okay, you're ready to go home now. You call the hospice provider, and it's not an automatic readmission. It's a reevaluation. The nurse will come out again just like they did the first time and see if you are hospice appropriate. Say you go for a broken bone from a trip and fall. Once again, that is not a normal result of colon cancer. So you do want to call your hospice provider and let them know what's going on. But if you call 911 and go to the ER for treatment of a broken bone, chances are your insurance will cover it. Difficulty breathing. That's kind of a gray area, because if your cancer has by some chance spread to your lungs, that's something that probably would have come on slowly, and a hospice company can still palliate that symptom. We give you oxygen, we give you breathing treatments, we give you prednisone, various things to help your breathing. So if you go for difficulty breathing, gray area, may or may not be covered by your insurance. You may or may not get a bill, but it's definitely something you want to call your hospice provider about first. Pain. Pain is what hospice deals with constantly. So pain normally doesn't start at a moment's notice. If the pain is increasing, it could be a variety of things. It could be something pressing against an organ internally. You know, the cancer has spread and it's moving something that doesn't want to be moved. And so pain is something we have the ability to give you just about any medication, any legal medication there is to take care of your pain. And a patient that is on hospice, that is our #1 priority, is comfort. So that's something that you absolutely, when it starts, if it changes, if it gets worse, you want to call your hospice provider and get that taken care of. If for some reason we are not able to control your pain at home, there is a GIP level of care wherein, when you're on hospice, we can admit you to the hospital, get your pain under control, and then bring you back home. But that is something the hospice has to pre-approve and actually instigate before it's covered by hospice. So let's look at the definition of emergency. We're so spoiled because we have hospitals, we have ambulances, we have access to emergency professionals much more than other places possibly. So an emergency room is for emergency treatment. What is emergency treatment? The definition of emergency is right here on this slide, and it's an unforeseen something or other that happens that requires immediate action. When you're on hospice, there is very little other than a fall, injury, excessive bleeding that is unexpected or unforeseen. So if you talk to your hospice provider about any new symptoms you have, chances are that can be controlled adequately without going to the emergency room. This is me, Holly VNP, and there's my email if you have any questions or comments about this presentation. I'd be happy to speak with you, and thank you for your time.